My name is Yvonne Bruehmann. I'm one of the dentists at Callander. I do general dental work and also restore implants. Elizabeth came to me a while ago with a tooth which we needed to take out. We had discussed all the options with her, detailing where she could go from there, and we decided that an implant was the best solution for her. I referred Elizabeth to Tim for the implant placement. Once the implant was placed, she came back 7 to 10 days afterwards for suture removal with me. We check usually on that appointment how the gum has healed, how the implant has healed, and look for any possible complications. Everything was really well with her, and we could let her go home with a normal regime of cleaning her teeth with a softer toothbrush. You need to be particularly careful in the first period of time to not touch it too heavily so that the implant integrates with the surrounding gums and bone. 10 to 12 weeks after the placement of the implant, the patient usually returns to us for the restoration of the implant. This is done over 2 appointments. These appointments are 2 weeks apart from each other. On the first appointment, a patient gets usually numbed with an injection in the area. We determine together with the patient the shade of the new crown or bridge work, what we're planning to do, and then commence with an intraoral scan. On the next appointment, your restoration gets fitted. This is usually done under another local anesthetic scan. She was delighted with the result, and I referred her on now to our hygienist who will take care of the regular maintenance of her implant.
Hi, I'm Tim. I'm one of the implant dentists at Infinity Blue. I first met Elizabeth when she was referred to me by her dentist Yvonne. Elizabeth was about to lose a tooth towards the front of her mouth that was going to be in her smile line, and she wanted to have a conversation about what she was going to do after she lost this tooth. We had a sit down and a chat, and we went through all our options, and we came to the conclusion that we'd go for something that was fixed and that Elizabeth could bite on, that she could smile with and be confident with going forward. What we decided to go for was a single dental implant. For Elizabeth, we decided to use the latest technology and do it all digital, and we planned this digitally to allow us to choose the position of the implant before Elizabeth even came in the room. This allowed her to have a look at it, see what her end result was going to be before she even committed to going ahead with it. By doing the implant digitally and guided, this allowed us to place the implant in the best location for Elizabeth and therefore give her the best long-term outcome. Once the implant was placed, we referred the patient back to the referring dentist for the restorative phase, where they would then take the scans and impressions and fit the crown.